Good morning, dear colleagues. It's 11 sharp, the 7th of February 2022. Let me declare open a session of the Dissertation Council. Please take your seats, everybody.
Что не так?
Let me announce technical break number 1, since one of the council members is absent.
Все, отлично. Тогда продолжаем. Итак,
Then let us continue a session of the Dissertation Council for defense of thesis by Drozdov, Aleksandr, Andreevich for degree of candidate of medical sciences, scientific specialty 3.1.25, diagnostic radiology, on the theme magnetic resonance imaging in differential diagnosis of brain lesions in patients with AIDS. By the order of Academic Secretary of St. Petersburg University, Gniotov Aleksandr Valentinovich, dated the 22nd of November 2021, number 11234/1, me, Ananyeva Natalia Isayevna, Doctor of Medicine, Professor of the Scientific, Clinical and Educational Center, Radiation, Diagnostics and Nuclear Medicine at St. Petersburg University, Head of the X-ray Department of the Bekhterev National Medical Research Center of Psychiatry and Neurology, was appointed Chairman of this Dissertation Council. Other members of the Council were appointed with the same order, and let me introduce them to you. Konstantin Ivanovich Sebilev, Doctor of Medicine, Professor, leading researcher of the Research Laboratory of Pathopathology of the Nervous System, Head of the Department of Radiation Diagnostics of the Russian Research Neurosurgical Institute, named after Professor Polenov, branch of the Almazov National Medical Research Center. Svetlana Vladimirovna Serebrikova, Doctor of Medicine, Head of the MRI Department of Clinic Number 1 of the All-Russian Center for Emergency and Radiation Medicine, named after Nikiforov. The Council meeting is attended remotely by Andrei Vladimirovich Mishenko, Doctor of Medicine, Professor, performing therapeutic work at the Scientific, Clinical and Educational Center for Radiation Diagnostics and Nuclear Medicine of St. Petersburg University, Chief Physician of the Pletnev City Clinical Hospital of the Moscow City Health Care Department. Andrei Vladimirovich, can you see and hear us? Yes, the answer is positive. Good morning, colleagues. Yes, I can see and hear you. Thank you. Gennady Evgenievich Trufanov, Doctor of Medicine, Head of the Department of Radiation Diagnostics and Medical Imaging, Institute of Medical Education, Almazov National Medical Research Center. Gennady Evgenievich, can you see and hear us? Yes? Dear colleagues, dear Natalia Isayevna, I can see and hear you well. Yes, we can see and hear you well. Vladimir Alexandrovich Fokin, Doctor of Medicine, Professor of the Department of Radiation Diagnostic and Medical Imaging, Institute of Medical Education, Almazov National Medical Research Center. Vladimir Alexandrovich, can you see and hear us? Thank you, colleagues. Pavel Dmitrovich Demeshko, Doctor of Medicine, Associate Professor, Chief Researcher at the Radiotherapy Laboratory of the Aleksandr Republican Scientific and Practical Center for Oncology and Medical Radiology, Republic of Belarus. Pavel Dmitrievich, can you see and hear us? Yes, dear colleagues, we can see and hear you. Yes, we can also see and hear you perfectly well. Thank you. And the degree applicant, Drozdov Aleksandr Andreevich, is also present. The academic thesis supervisor is also present, Doctor of Medicine, Professor of the Department of Oncology of St. Petersburg University, Cheremisin Vladimir Maximovich. In order to improve the quality of communication, dear colleagues, I kindly request those of you attending remotely to switch off your microphones and to switch them on only when you are given the floor. Thank you for your understanding. Let me also inform you that our session is being recorded and broadcast live at St. Petersburg University website. The speeches are being simultaneously translated from Russian into English or from English into Russian. During the live broadcast of the Dissertation Council session, at the moment an email is displayed to which all the listeners may send questions to the degree applicant or express their opinion regarding the content of the thesis, the applicant's speech, the current scientific discussion, and thus take part in the discussion. These questions shall be forwarded to me by our technical support department, and I shall present them during the discussion. Questions should be related strictly to the applicant's speech and the content of the thesis. It's necessary to indicate full name, position, and place of employment of the author. Questions that are not related to the scientific discussion of the thesis, the text and assessment of the thesis itself, as well as anonymous questions shall not be presented. In accordance with the order of awarding at St. Petersburg University of the degree of Candidate of Sciences or Doctor of Sciences approved by the local regulations of St. Petersburg University, a session of the Dissertation Council shall be considered competent if at least 2/3 of the appointed members are present, but not less than 4 persons. Our council consists of 7 persons, and all 7 are present, including 4 council members present remotely. Audio-visual contact has been established with them. Thus, we have the quorum. I invite the Dissertation Council Activities Support Department Officer, Curator of the Defense, to draw up the attendance list. Let me set forth the following procedure of today's session of the Council with approximate duration of 2 hours. Chairman, summary report about the applicant and documents submitted and their compliance with applicable regulations. Answers to possible questions, 5 minutes. Summary report of the degree applicant outlining the key points of his research. Questions to the applicant and applicant's answers. Presentation of external reviews. Speeches of all the council members in turn with their assessment of the thesis and the applicant's speech, as well as questions and suggestions to the applicant. Also, speech of the chairman with his assessment of the thesis, answers of the applicant to questions and comments of the council members, and open discussion speeches at will of the attendees with summaries of their positions and our specific questions and suggestions to the applicant strictly on the theme of the thesis. At that, I kindly request all the speakers to register themselves and introduce themselves before speaking, indicating their full name, degree, position, and place of employment. Presentation of questions to the applicant received during the discussion of his presentation and the ongoing scientific discussion during the live broadcast of the council session at St. Petersburg University website. So that's the next point. Let me inform you that written questions, presentation of which takes over 2 minutes, shall not be presented. Answers of the applicant, speech of the thesis supervisor, discussion by the council members of the defense results, and open individual voting. Counting the votes shall be counted by the chairman, and the results shall be recorded in the minutes of the meeting. Making decision on awarding or not awarding the degree, and closing remarks of the applicant. Dear colleagues, do you have any questions or objections to this procedure? Since everybody is silent, I assume there are no objections. No, there are no objections. Then, let's start the procedure. Please remember to switch off your mobile phones. Dear council members attending the session remotely, please leave your phones on so that we could reach you in case of emergency. Thank you for your understanding. Let me start the session. Let us start the session. A thesis by Drozdov Aleksandr for the degree of Candidate of Medical Sciences, Scientific Specialty 3-125, Diagnostic Radiology, on the theme Magnetic Resonance Imaging in Differential Diagnosis of Brain Lesions in Patients with AIDS, was accepted for defense by the Academic Secretary Order dated the 1st of November 2025, number 10661/1. Drozdov Aleksandr Andreevich wrote his thesis at St. Petersburg State University. As a doctoral student, his thesis supervisor is the Doctor of Medicine, Professor of the Oncology Department of St. Petersburg University, Cheremisin Vladimir Maximovich. The number of the applicant's publications, which set forth the key results of his thesis, according to the enclosed list, is 5. In peer-reviewed scientific journals from the list approved by the Ministry of Science and Education of Russia, 4 publications. In journals indexed in the scientific databases, Web of Science and Scopus, 1 publication. All the documents, according to the information I received from the curator, comply with the St. Petersburg University regulations and are kept in the applicant's attestation file. Copies are available from the Dissertation Council Activity Support Department officer, who is now present at the session. Before I give the floor to the applicant, I have a question for the Dissertation Council members. Dear Council members, do you have any general questions to the applicant? And is it necessary to review the entire list of documents submitted by the applicant? No. No. Thank you very much. Now, let's proceed to the applicant's summary report. Aleksandr Andreevich, the floor is yours. Hello, distinguished Natalia Isayevna, members of the Council, colleagues and guests. According to UNAIDS, the Eastern Europe and Central Asia region, predominantly represented by statistics from the Russian Federation, saw a more than 10% increase in the number of people living with HIV in 2019. This is the highest percentage increase in the world. The nervous system is second only to the immune system in terms of frequency of an infection. According to postmortem autopsies, the prevalence of CNS lesions reaches 80%. A feature of the infection in Russia is that tuberculosis remains the leading cause of death among the patients. The aim of the study was to improve the accuracy of diagnosis of brain lesions in patients with HIV infection at the stage of AIDS using the modern magnetic resonance imaging capabilities. Study objectives: to optimize the technique of MR imaging of the brain, the common diseases in patients with AIDS. Second, to study and supplement the magnetic resonance semiotics of the most common brain lesions in patients with AIDS and to develop an algorithm for differential diagnosis of these conditions. 3. To explore the use of delayed contrast for differential diagnosis between brain metastatic lesions and toxoplasmosis in patients with confirmed and suspected AIDS. And 4. To explore the feasibility of stratifying patients with unknown HIV status for AIDS based on a set of specific brain MRI effects. Inclusion criteria was age over 18, HIV infection at the stage of AIDS, and either clinical signs of possible nervous system lesions or CD4+ over 50 cells. Thus, the study group consisted of patients at stage 4B of 5 according to the classification of Pokrovsky. The work is based on the analysis of 255 MRI examinations of 172 patients. All studies were performed with an MRI with a magnetic field induction of 1.5 Tesla. The developed protocol included standard protocol sequences. And then those not working, such as T1 weighted images, diffusion weighted images, magnetic susceptibility weighted images, intravenous contrast, post-contrast T1 weighted images, and T2 weighted images. The protocol also included a modified sequence, namely post-contrast T2 pulse sequence, and 2 additionally is from adipose tissue and post-contrast T1 weighted image. The MRI data were compared with laboratory tests such as PCR, antibody tests against different pathogens, SPET, CT, and CT methods of TB detection such as urine, stool, sputum culture on solid and liquid media, sputum culture on Bactec media, microscopy of fluids and tissues to isolate acid-fast mycobacteria with methodological investigations such as stereotactic biopsy results, autopsy, and the nature of the response. Provision to be defended. Number 1. The developed protocol for AIDS patients increases the sensitivity, specificity, and diagnostic accuracy of MRI examinations. The optimized protocol differed from the standard protocol in the presence of 2 added sequences and 1 modified sequence. A retrospective analysis of 172 studies was performed to assess the feasibility of the added sequences. 2 radiologists independently compared the sequences with the standard post-contrast T1 weighted images and assigned an evaluation. If performing the added sequence yielded new clinical information, a score 1 was assigned. If no new clinical information could be obtained by performing the sequence, score 0 was assigned. Thus, delayed post-contrast T1 weighted images provide new clinical information in 32 patients or 18.6% of cases. However, for 6 patients, pathology was detected only on the added sequence. For post-contrast T1 weighted images with suppression of adipose tissue signal, additional information was obtained for 3 patients, but for all 3 patients, pathology was detected only on the added sequence. A prospective experiment was performed to assess the feasibility of modifying and performing post-contrast T2 instead of the standard pre-contrast scan for 39 patients, which included obtaining both the standard and modified sequences. Then 2 radiologists independently assessed the value of the modified sequence with the standard sequence. If the modified sequence was more informative than the standard, a score 1 was assigned. If the informative value was equal, a score of 0, and if the standard sequence was more informative than the modified sequence, a score of -1 was assigned. In all cases, the modified sequence was no less informative than the standard sequence, and in 2 patients with a modified sequence, detected pathology that was not detected in other scanning protocol sequences. Cohen's kappa was calculated to assess the degree of agreement among radiologists in interpreting the sequences, which was at least 0.79 for each of the sequences, a very high degree of agreement among radiologists. When evaluating the optimized protocol against the standard protocol, the sensitivity of the method increased specificity increased from 87.9 to 90.9%, and diagnostic accuracy increased from 84.3 to 91.3%. Provision to be defended number 2. 8 associated brain lesions have characteristic MRI features that, in most cases, can correctly identify the etiology of the disease. Out of 172 patients, toxoplasmosis was in 20% of cases, progressive multifocal leukoencephalopathy in 10%, primary CNS lymphoma in 4%, manifested in severe HIV encephalopathy in 4%, and no structural lesions detected in 23% of cases. We present a list of differential diagnostic signs in the group of structural lesions. The following are significant: the presence of proteinous inclusions, which has full specificity but limited sensitivity in 28.6%. The other, multifocal nature of lesion, typical location in subcortical parts of the cerebellum and hemispheres, the symptom of eccentric target. The sign also has a high specificity but limited sensitivity of 40%, and symptom of concentric targeting, which is marked with an asterisk because it was not significant in the overall group, but showed significance in the differential diagnosis of toxoplasmosis with primary CNS lymphoma. For primary CNS lymphoma, the monofocal nature of the lesion and their preventricular localization were significant. For tuberculous abscesses, the feature of significance was a uniform width of contrast agent accumulation. The sign demonstrated high sensitivity and full specificity. In the group of structural brain lesions without a mass effect, the following signs were found to be significant: subcortical spread of the process to the so-called U-shaped fibers, peripheral restriction of diffusion at the boundary of disease and healthy brain parenchyma, accumulation of contrast agent in any patent, and predominantly infratentorial spread. Here is an example of some of these signs. The first image for toxoplasmosis shows the eccentric target symptom, which is characterized by additional accumulation of contrast adjacent to the main ring of contrast accumulation. The second image presents the symptom of proteinous inclusions, which is characterized by the presence of T1 inclusion in the structure of pathological foci on the sectants. The second column presents a typical CNS lymphoma with periventricular monofocal lesions. And the last group of images is a tuberculoma with a high precision rim of uniform contrast agent accumulation. Summarizing a set of 13 significant features, we present the algorithm developed for the differential diagnosis. In case of lesion with mass effect, the next thing to clarify is whether there is an accumulation of the contrast agent. If the width of the contrast medium should be clarified. And if it is irregular, the next step is to rule out a rare variant of PML. Next, we determine whether there are proteinous inclusions. The inclusions are found, we deal with toxoplasmosis. If not detected, we proceed to the assessment of the medium sensitive and medium specific signs. If at least 2 of the 4 signs are found, we are dealing with toxoplasmosis. If not, we raise a concern for PPCNS. In the group of structural brain lesions without mass effect, it is necessary to differentiate between PML and manifestation of severe HIV encephalopathy. If at least one symptom is found, the picture is much more likely to be consistent with PML. If no signs are found, the diagnosis is in favor of HIV encephalopathy. Provision to be defended number 3. A new MR sign of central accumulation of contrast agent and 30-minute delayed post-contrast T1 weighted images has been established. The sign allows differentiation of toxoplasmosis from metastatic lesions. Patients with multifocal brain lesions, circular accumulation of contrast media, and a confirmed diagnosis of toxoplasmosis of metastatic lesion were selected. The toxoplasmosis group consisted of 21 patients with 64 analyzed foci. From the metastatic lesion group consisted of 17 patients and 89 metastatic foci. Each of the patients underwent MRI scans, and post-contrast were obtained immediately after contrast agent administration after 15, 30, and 45 minutes. Contrast accumulation in the central parts of the foci was subsequently assessed. Thus, the absence of contrast agent accumulated was typical of toxoplasmosis, while metastatic lesions are characteristic by contrast agent accumulation over time. Here are some examples. On the left side of the screen, a T1 weighted image of a patient with lung cancer metastasis in the left frontal lobe immediately after administration of the contrast agent. The pathological focus demonstrates circular accumulation of the while delayed imaging for 15 minutes demonstrates central accumulation of contrast agent, whereas no central accumulation. The sensitivity of the method was 88.2%, specificity of 95.2%, and diagnostic accuracy of 92.1%. The provision to be defended number 4. For patients with unknown HIV status, a cluster of weakly specific factors from brain MRI data provide grounds for further investigation for AIDS. To test this hypothesis, a list of attributes was formulated. The requirements that were imposed as a list of 14 requirements. So here is the list. The requirements that had to be detectable by routine non-contrast MRI. It must not be an AIDS-defining condition. It must be more common in HIV-negative patients than in HIV-positive patients. 2 groups of patients were formed, 36 patients with AIDS and 12 HIV-negative patients. The significance of the features was assessed between the 2 groups, and integer scores were assigned to the significant features. For each of the patients, the sum of the points was calculated and thresholds were defined, from which we considered the test value to be positive. 2 properties were determined: sensitivity, specificity, and accuracy. Significant features include transverse size of the anterior horn, ratio of transverse cranial size to the transverse size of the lateral ventricular bodies, expansion of the perivascular spaces of the basal ganglia, presence and number of focal changes in the substance of the great hemispheres, wall swelling of the mucus of the sinuses, and anterior-posterior size of the tonsil. When a cutoff point was 4, the sensitivity was 82.4%, the specificity 66.7%, and the overall accuracy 78.2%. When a cutoff point was 5 was used, the sensitivity decreased to 70.6%. The specificity increased significantly to 83.3%, with accuracy of 73.9%. In our opinion, it's more appropriate to use the method with a cut-off score of 4, as the method is closer to screening and therefore requires higher sensitivity than specificity. I ask permission not to voice the conclusions because they are present in the text of the thesis. Thank you for your attention. Aleksandr Andreevich, thank you very much. I have a question for the council members. Do you have questions to the degree applicant strictly regarding the report or the content of the thesis? maybe. Okay. Speech of the council members with their assessment of the thesis, and the speech of the applicant, and the applicant's speech with questions and suggestion, and presentation of external reviews, if any. The applicant may have a seat, whatever. Have to remain standing. Council, the member speeches. Since all the reviews were published at St. Petersburg University website, I suggest you read or present only the key points, questions or comments to the applicant. And do council members have any objections? No. No, we don't. Presentation of reviews of the council members. Let's start with Mishinka Andrei Vladimirovich. Andrei Vladimirovich, can you see and hear us? Thank you very much for this opportunity to speak first. And I also mean that my review was officially published, and anyone could read it and use it to prepare the council members and the degree applicant. I will not dwell, and I know there will be other speakers, but I'd like to underline that the thesis, in my opinion, is, in a sense, has novelty, and the approaches described reflect the modern developments of the science, and the approach used by the applicant corresponds to the modern level of medical science achievements, including radiodiagnostics. The attempt to identify insignificant and maybe not obvious symptoms and features of disease manifestation to increase efficiency of diagnostics and probability to confirm the diagnosis. So these symptoms, this corresponds to the modern image of nuclear imaging and its development and integration with general developments. The practical significance of the thesis is obvious, of course, on the basis of these approaches. The conclusions set forth, the results of the thesis, of course, or in the use of this technology enables to increase the competence of radiology for prognosis of serious and complex disease such as HIV and AIDS syndrome. That is why, in this respect, the work is quite relevant and up to date. As for the content of the thesis, I will not dwell on that because this is a classical presentation of research as we are used to it, and it complies with the requirements, the formal requirements applied to a thesis. As for questions that I would like the applicant to answer, which do not affect the significance of the work, and with these questions I'd like to emphasize the relevance and the methodology side of the work, which can be used in practice. In that sense, In that respect, I'd like to ask Aleksandr Andreevich the following question. First, how much the author, in how much detail the author studied the technology of information collection in contrasting. Why exactly I did not understand if the approach was empirical or the reasons from international literature. Why 15-minute intervals were used as sufficient to characterize changes in the brain? So that was my first question. Second, in the same line of assessment of vascularization or changes in contrasting, did the author consider MR perfusion analogy as a way to assess minimal, as the most perfect way to assess various minimal perfusion abnormalities in the brain? Third question, to which I would like the applicant to answer: if the author considered other ways to improve the quality of contrast accumulation display in neuroimaging used in other spheres, or to address other points such as transferrin magnetization or contrast agent dosage. And the final question, which I would like the applicant to answer: in summary, can MRI be considered as brain lesions with AIDS? Can it be considered? Can we consider the results of the thesis, meaning that the results of MRI after MRI we don't know further actions for verification are needed, and MRI results are sufficient to diagnose AIDS or exclude it? Or should it still be considered only as reflections of massive changes caused by this disease and not to verify the diagnosis? Thank you very much. And in conclusion, as I can read my conclusion of my review, after reviewing the thesis by Drozdov Aleksandr Andreevich on the significance of tomography for differential diagnosis in HIV/AIDS patients, we can conclude that the thesis is a complete piece of research for its relevance, novelty, practical and theoretical value, and reliability of conclusions. The work corresponds to the main requirements set by the order dated the 11th of November 2021, number 11-18-1/1, on the order of awarding academic degrees at St. Petersburg University, and the degree applicant Drozdov Aleksandrovich deserves awarding the degree of candidate of medical sciences, specialty 3.1.25. That's it. Thank you very much. I finished. I suggest that the applicant answers speakers. Aleksandr Andreevich, did you understand the questions? Dear Andrei Vladimirovich, thank you for your questions. in the section dedicated to differential diagnosis of metastatic lesions and toxoplasmosis, the main hypothesis was delayed cerebral accumulation of contrast agent. Thus, we first sought to answer the question of how long a delay interval between contrast agent administration and scanning was required to reliably detect the agent accumulation. And for that, 15-minute interval was sufficient. At the same time, the experiment could be complemented by a series of scans with high temporal resolution. As for the MR perfusion as part of the protocol, according to the hospital of Botkin Hospital, venous access has to be performed via peripheral catheters, and that is why in majority of cases we had to use pediatric catheters installed in small vein, and this type of access is insufficient for reliable perfusion. That's why we decided not to use the method as a permanent protocol element, though this is a good complementary method that can be used on indication. As for the methods of contrasting, in this study we didn't have the opportunity to compare the known dual contrast technique with the method under study. The magnetization transfer technique, though promising, has not proven clinically relevant in the setting of the Mariinsky Hospital, even when dealing with classic disease of multiple sclerosis, and therefore was not included in our protocol. Some other techniques, such as post-contrast T2 flare and with suppression of the signal from adipose tissue, have been successfully used in our study. As for the question whether the MRI self-sufficient method, the sensitivity and specificity and accuracy of the method were ranged from 91 to 92%. Thus, we conclude that the method is complementary, and the results have to be verified by other methods. At the same time, the method can be used to assess evaluate the dynamics of treatment and reduce the range of diagnostic measures in order to make the correct diagnosis. Thank you. Hopefully I answered your questions. Andrei Vladimirovich, are you satisfied with the answers? Yes, thank you very much. In principle, I'm satisfied, but I'd like to go back to my first question. If you the basis of differential diagnosis on the basis of 15-minute intervals, does it make sense to increase that interval, that time period, and not to do this interim scanning? Aleksandr Andreevich? Yes. So we conducted 7 tests with various time intervals, but to use this method in practice, one delayed scanning is sufficient, 30 minutes after agent administration. Thank you very much. Thank you. Next review of the council member, Gennady Evgenievich Trufanov. Dear Natalia Isayevna, dear council members, dear colleagues, dear Vladimir Maximovich, I also published my review of the thesis, so I'll try to make it a little quicker because I think that official opponents, council member should not speak take more time than the applicant. As a shame, Andrei Vladimirovich cannot hear me. Andrei Vladimirovich, can you hear me? Yeah, you can hear me because Andrei, it sounds as if you, Andrei Vladimirovich, is defending his thesis. I will only focus briefly on scientific novelty, obvious scientific novelty and high level of novelty confirmed with statistical data, and especially what I liked in the presentation is a comparative assessment by two experts, MRI technicians. Second, the applicant developed the so-called contrast MRI method, which allowed to increase the amount of information provided by the technique. Ability to identify new features that can be used for differential diagnosis of tuberculosis and other types of lesions. Next, the so-called delayed scanning, which, because scientific novelty is characterized, which can also be used as a method of differential diagnosis of toxoplasmosis, and this systematization of features, what was presented in the table of tuberculosis lesions, semiotics, and stratification of risks for AIDS, HIV infected with unknown with 10-point scores, which can be used, but as any council members have some question, and I only have one question. When analyzing the thesis, there are typos and maybe some inaccuracies which do not affect the essence of the work. This is a major piece of research. 175 has lots of diagrams and figures. Indeed, that is a serious stuff. So I only have one question. What is the reason for the sample size in the pilot study on stratification of patients for AIDS by MRI data? And dear Natalia Isayevna, shall I wait for the answer or shall I read the conclusion? I think you can read the conclusion of your review, and then Aleksandr Andreevich will answer. Okay, thank you. Thus, on the basis of material presented in the thesis, I conclude the thesis by Drozdov, Aleksandr Andreevich, the brain in radiation diagnostics, complies with the main requirements set by the order on the dated the 19th of November 2021 on awarding academic degrees at St. Petersburg State University. And the degree applicant Drozdov Aleksandr Andreevich deserves awarding the degree of Candidate of Medical Sciences, Specialty 3125, Radiology Diagnostics, council member, Trufanov Gennady Evgenievich. Thank you for your attention. Gennady Evgenievich, thank you very much. Aleksandr Andreevich, can you answer the question? Yes, of course, Natalia Isayevna. Dear Gennady Evgenievich, the small sample size is due to the fact that for the pilot experiment we decided to form a minimal but at the same time statistically justified control group. So we were careful when selecting patients, and each patient in the control group with negative HIV test during the previous year. Before Gennady Evgenievich, are you satisfied? Yes, thank you very much. Thank you very much. The third review by Vladimir Alexandrovich Fokin. Good morning, dear colleagues. Speaking of the Aleksandr Andreevich thesis, I'd like to emphasize high relevance and a great number of studies conducted and here I'd like to emphasize the practical significance of this work for a radiologist, and other conditions. Lots of it is dedicated to semiotics of tuberculosis, lesions, and other infections, and the author demonstrated differential diagnosis, the nature of accumulation. And here I'd like to mention the fact that is usually recommended to use 5-20 minutes, and the author tried to increase the time period and characterize explained the choice of greater delay compared with recommended delay, and this such delayed contrasting method enables to set forth the differentiation principles. Besides, the author has quite well described the algorithm presented and suggested a stratification scale with scoring system which can be applied to the information obtained during scanning. As for the questions, as I don't have any major questions because the scope of the work of the sample size is quite large, 172 patients. I have the following question. Please tell us, Andrei Alexandrovich. So the question is connected with what was already asked. Is MR perfusion considered to be ideal and can be used to so why in the protocol you have not included the MR perfusion, was not included, which could be helpful in differentiating. Of course, the work deserves a positive assessment, is coherent, well presented study, and on the basis of this study I would like to conclude that the work of Aleksandr Andreevich Drozdov radiation diagnostics and nuclear medicine complies with the requirements set forth by the order on the 19th of November 2021 on awarding academic degrees in the Petersburg University, and the degree applicant deserves awarding the degree specialty 319 nuclear radiation diagnostics and nuclear medicine. Thank you. Aleksandr Andreevich, are you ready to answer the question of Vladimir Alexandrovich? Dear Vladimir Alexandrovich, indeed, MR perfusion data would be very useful indeed, and so we hoped to be able to include it, but we ran into a technical difficulty with peripheral catheters in most patients. As a result, we had not to include perfusion in the standard protocol and recommend it as a method, as an additional method pro renata. Vladimir Alexandrovich, are you satisfied? Yes, of course, thank you. Thank you very much. Next review by Pavel Dmitrievich Dimeshko. Good morning, Natalia Isayevna and council members and attendees. I would like to focus on the practical significance of this work, and maybe from the point as an oncologist. The thing is that we often face situations with patients with known HIV status and brain lesions, lymphoma or metastatic lesions, and we are facing the question of what to do next with such patients, and unfortunately not always it's possible to verify this process. I mean foci location because of patient condition, etc. So diagnosis has to be based on a set of clinical data and decide on treatment. And of course, in specific treatment, administering specific with tuberculosis or toxoplasmosis lesion can be fatal. That is why, speaking of practical significance, I'd like to emphasize this algorithm of diagnostics, which can be used to determine signs, significant signs, and the system of assessment of signs, MRI signs, which can be used for differential diagnostics, especially this section dedicated to metastatic lesions. The idea of using this non-specific MR data for stratification of patients, HIV or AIDS, in my opinion, it's an interesting idea, but as a generational hypothesis which has to be maybe explored in the future and it has to be validated in the future on external sample. The thesis itself, I don't have any major questions. I have some minor questions to the applicant. One question is about a modified protocol. It can be used only in HIV patients or in other patients as well. The second question is which is the most complex for differential diagnostics. And the third question has already been voiced, is the use of dual dose contrast media. So this question has already been answered. So maybe in conclusion, after having read the thesis and the thesis by Aleksandr Andreevich is an independent and complete qualification work performed on a high methodological level, which addresses a relevant practical issue of diagnosis of brain lesions in patients with AIDS, compliance with the requirements set forth by the order on awarding academic degrees. And Aleksandr Andreevich deserves awarding the degree of Candidate of Medical Sciences in Diagnostic Radiology. Thank you. Aleksandr Andreevich, did you hear the question? Can you understand the question? Dear Pavel Dmitrievich, as for the use of optimized protocol in general population, the use of such protocol can identify more diseases, but scanning will takes more time as compared with a standard protocol, and so we need to study the appropriateness more. As for the most difficult AIDS-associated diseases, most difficult to differentiate, in our study the greatest difficulty was the diagnosis between toxoplasmosis and primary lymphoma of the central nervous system. As for the dual contrast as compared with delayed contrast, the question has already been asked, and I absolutely agree that this question is of high scientific and practical significance. So we have not conducted a study and has not been described in available literature, so that will be an interesting field for further studies. Thank you. Pavel Dmitrievich, are you satisfied? Yes, I am. Thank you very much. Next review by Konstantin Ivanovich Sebilev. Dear Chairman, dear Council members, dear thesis supervisor, I will not talk about relevance, scientific novelty, and practical significance. What I liked most in this work, against obvious scientific novelty, I love the algorithm, which is clear, which can very well be used in practical healthcare, is different from many modern algorithms, the essence of which is let's use every method available, but here we see absolute coherency. I'd like to thank the applicant for an excellent presentation. I have a couple of questions which do not affect the impression, only for the sake of discussion. So the first question is, do you recommend the use of stratification tests for all patients that undergo MRI scanning? And second question, what do you see as future prospects for development of stratification based on MRI brain scans? And in conclusion, I'd like to say that the thesis by Drozdov Aleksandrovich on the theme Significance of MRI Imaging in Differential Diagnostics of Brain Lesions in Patients with AIDS, submitted for the degree of Candidate of Medical Science Specialty 315 as a complete scientific qualification work performed on a high scientific and methodological level. The thesis addresses a relevant scientific and practical task, increasing efficiency of brain lesions in patients with HIV with the use of MRI capabilities. For relevance, practical significance of conclusions and practical recommendations, the thesis complies with the key requirements set by the order the 19th of November 2021 11-18-1/1 and the order of awarding academic degrees at St. Petersburg University. In the degree applicant Drozdov Aleksandr Andreevich deserves awarding the sought degree of Candidate of Medical Sciences, Specialty 3, 125, Radiology, Diagnostics. Articles 9 and 11 of the above mentioned has not been council member, head of Doctor of Medical Sciences, head of a research laboratory of pathopathology, Stable of Konstantin Ivanovich, Aleksandr Andreevich. Please answer the question. Dear Konstantin Ivanovich, speaking of the use of stratification for all the patients, so we have only conducted a pilot study which demonstrated the validity of this approach, but the accuracy and specificity of this method today are not high enough to recommend this method for general use. Speaking of the prospects of development of this technique, in our opinion, or in my opinion, it's advisable to include it. The stratification tells in MRI tensor, MRI morphometry, so these would allow to increase the method accuracy, and maybe with that the method could be used generally and widely. Thank you very much. Next review by Serebrikova Svetlana Vladimirovna. Dear council members, dear chairman, I will not talk too much about this good work. Let me just say that I enjoyed reading it. I found many interesting details because nervous system lesions in most AIDS patients are numerous and are characterized by various changes caused by the disease. And let me proceed right away to questions that I got while reading this thesis. How, despite a relatively small group of patients, of 37 patients with urotuberculosis, 10 variants of cerebral tuberculosis lesions, in comparison with literature, a larger number of variants were found in a smaller sample. What factors led to such a result? Is this the analysis of own results, or you used findings from the literature? And second question, in your opinion, to what extent the findings of the study relate to the local endemicity of the opportunistic diseases, and would it be appropriate to apply the recommendations to other regions and countries? And let me read the conclusion that the thesis by Drozdov Aleksandr Andreevich as the use of MRI imaging in differential diagnostic brain damage conducted under supervision of Doctor of Medical Sciences Professor Cheremysin Vladimir Maximovich, submitted for the degree of Candidate of Medical Sciences, Specialty 3, 125, Radiation Diagnostics, is a complete qualification work which addresses a relevant scientific and practical task to improve accuracy of diagnostic of brain lesions in HIV patients at AIDS stage with the use of capabilities of MRI for its relevance, novelty, and the amount of research and practical significance of received results. The work corresponds to the requirements set by the Order on Awarding Academic Degrees at St. Petersburg University, and the degree applicant, Drozdov Aleksandr Andreevich, deserves awarding the degree of Candidate of Medical Sciences, Specialty 315, Radiation Diagnostics. Articles 9 and 11 of the above-mentioned order has not been violated. Aleksandr Andreevich, are you ready to respond to Svetlana Vladimirovna? Dear Svetlana Vladimirovna, the study group consisted of patients with the most unfavorable prognosis of the cause of tuberculosis in the presence of AIDS. which allowed to reveal such a variety of forms of the disease in a relatively small sample of patients. All forms identified, detected by our study do not exclude, do not contradict literature. And as for the local spread of the disease, of course, the prevalence of opportunistic diseases depends on the region in which they live. At the same time, the algorithm is based on sensitivity and specificity, which do not depend on the prevalence of the disease, which allows using the recommendations in other regions and countries. Thank you. Svetlana Vladimirovna, yes, I am satisfied with the answers. Thank you very much. And finally, let me present my review by Ananyeva Natalia Isaevna. I will not repeat that the thesis is relevant, logic, coherent. The conclusions are well justified, correspond to the set task and the relevance of the results. And I'd like to get answers to some questions, but some answers I have already heard, because in the questions asked by other council members, some of the questions were similar, such as the period for delayed contrast, also which of the post-contrast sequences showed the best contrast and were most informative, and second question, which of the listed forms of tuberculosis of central nervous system in patients with AIDS had the most prominent neurological symptoms, in your opinion? But in general, the work deserves positive assessment. I don't have any major comments, and after reviewing the thesis on the significance of MRI tomography in differential diagnostics of brain lesions in AIDS patients, I can conclude that by its relevance, amount of work, scientific and practical significance, this is an independent qualification work which has a high level of scientific significance, and it complies with the main requirements set by the order dated the 11th of November 2021, number 11181, on awarding academic degrees at St. Petersburg University. And the degree applicant Drozdov Aleksandr Andreevich deserves awarding the degree of Candidate of Medical Sciences, specialty 3125, nuclear diagnosis, and articles 9 and 11 of the above mentioned order has not been violated. Aleksandr Andreevich, can you answer my questions? Dear Natalia Isaevna, speaking of the most informative post-contrast sequences, the most informative we obtained from tuber spin traditional because of high signal-to-noise ratio. Important clinical information was obtained in post-contrast T2 flare due to a different type of contrast, and from post-contrast T1 weighted images with adipose signal suppression due to the fact that it became possible to examine tissue saturated with fat cells. Of the listed forms of tuberculosis, the most prominent clinical symptomatology was seen in patients with leptomeningitis, especially when MRI findings are present. Thank you very much. I am satisfied. Dear colleagues, council members, is everybody satisfied with Aleksandr Andreevich answers. Thank you very much. We received no external reviews, so I would like to know if any of the attendees who's not a member of the council members, is willing to speak. Yes, please. Not more than 2 minutes, please. Of Diagnostics of Oncology, Department of St. Petersburg University. Dear Chairman, dear Council members, dear guests, colleagues, I would like to characterize Aleksandr Andreevich as a student. He was enrolled in 2012 as a 6th-year student, and he decided to take up radiology when he was only a student. I assigned a theme to him with the Mariinsky Hospital because my thesis was in that field, and though the work was quite complex, he completed it, and I saw that he had this talent for science, which will enable him to become a scientist. Then he started his residency, and for 2 years, unlike other resident students, he worked hard, and considering that we met in his 6th year, we continued to conduct research in radiation safety. We have done a lot with Radiation Hygiene Institute, and when he decided to take up a postdoctoral course, as I was head of the MRI department, we decided that the most complicated field is to assess MRI capabilities in infection detection. His colleagues with whom he wrote a work on criteria of MRI scanning in HIV patients, and maybe Aleksandr Andreevich then started thinking about that, and after residency he took up this work. The atmosphere in the Mariinsky Hospital was very favorable. They had lots of patients from AIDS Center, from Botkin Hospital, so there was it was a very highly relevant question. Diagnostics of metastatic lesions discussed today. So I'd like to say that Aleksandr Andreevich was a brilliant student, unlike other resident students and many our doctoral students. And so these 10 years of hard work is due, I think, to rather successful, and I think that the council members will support me and vote that he complies with the regulations. He has achieved a lot over these 10 years, dedicated a lot to our sphere, to our science, and as he spoke today, is also symbolic that he's the first applicant. 1.5 years this council was established at our university, so he is our first student to defend his thesis. Aleksandr Andreevich, well done. I'm proud of you, and I hope that council members will support you. Thank you very much. Elena Grigorievna, thank you very much. Do you have any questions regarding the thesis? No, everything was clear to me. Thank you. Thank you. Is anybody else willing to speak? Natalia Alexandrovna, may I say something? While the speaker is on his way, Natalia Isaevna it seems that the thesis supervisor is not Vladimir Maximovich. Let me answer instead of Elena Grigorievna. She's Natalia Isayevna. Elena Grigorievna is, she came, Elena Grigorievna characterized and said that he is her student. Elena Grigorievna, can you answer the question? He's my student, as a student, as a graduate student, resident student, and only in that sense, and also as a radiologist of the radiology department of Mariinsky Hospital. He's a colleague of mine, but his thesis was written under supervision of Professor Cheremysin. I beg your pardon, dear Natalia Isayevna. Today we heard so this is defense of a thesis. So I think it doesn't sound good. This is a dissertation council. We are discussing research. So I beg your pardon. It jumps one in the eye. Yes, Gennady Evgenievich, I agree. We will give the floor to Vladimir Maximovich later. Dear chairman of the council, dear council members, dear colleagues, I'd like to say that the work has practical significance, and Aleksandr Andreevich performed his work not as a radiologist but as a clinical doctor. He examined all the patients and personally, and we are very grateful to Aleksandr Andreevich, because a new department opened. Lots of work was done, and then they told us that you have to open a new department in 3 days, and we managed to do that only thanks to Aleksandr Andreevich. Do you have any questions? Or maybe no, I don't. Thank you very much. Next item of our agenda. Have we received any questions online? No questions regarding the content of the thesis, and during the live broadcast we have not received any questions. Thus, Vladimir Maximovich, the floor is yours. The thesis supervisor. The thesis supervisor, please tell us about the applicant and his work. Dear Council Chairman, dear Council members who are present remotely, dear colleagues, friends, first of all, I would like to respond to Gennady Evgenievich. You know, when you wrote one thesis, and I was your thesis supervisor, but in fact, our entire department, maybe, yes, exactly. Maybe you remember how much they got into details of your work. So it went through rigorous inspection. So that is a normal situation. And I would say that we sat together and discussed this topic, which was born at our department, and Elena Grigorievna is responsible for academic work, and she was head of the radiology department, which included MRI, and this topic was born because in Botkin Hospital and AIDS Center. They had no MRI equipment of their own, so they referred their patients to them. And Aleksandr Andreevich, he looked at the technical, he dealt with the technical side. He worked as the operator, and so he also liked this topic, and he got this topic because indeed it is highly relevant, and maybe not everybody is still understands how relevant it is, because growth, the number of such patients is growing. I mean, patients with AIDS, and because of compromised immune system, they get different complications. And I'm also proud of our department, the head of which is Elena Grigorievna, because we saw when we got patients, external patients, and we saw conclusions they received at various outpatient clinics. They said many different things. We immediately were able to see toxoplasmosis and other things related to AIDS. So that's how the topic was born, and it ended up in good hands. And a lot Aleksandr Andreevich was able to do after he graduated the university in 2013. Our applicant, he completed his residency, his doctoral course, and over these 5 years he wrote his qualification work, defended it, and besides he has done many other things. He became a mature in the beginning, his residency in the US in internal medicine. Then, that was in Washington. Then he completed a course in neuroradiology in New York, and now in Texas he is, as they say, a resident. He's a resident doctor in Texas. But as he is, we still maintaining this connection. We still have this connection, and as a person who's passionate about learning something new, and we hope that he will come back to us, because the period when he was a doctoral student was very bright and good example to all other resident doctors and all other doctors around him. His energy and his desire to learn were infectious, and he is the man who never stops learning and sharing. Everybody likes him at our department, at our hospital, because, as Dr. Feduniak said, indeed he took part in conferences and constantly watched, monitored these patients, and took deep interest in all other clinical studies. I cannot judge his work, and we already heard the opinions of the council members present here, and one thing I can do is wish that everything happens, and he's the man who today can identify a problem. He can also solve a problem, and I hope that after some time he will present his doctoral thesis to us as well. Thank you for this excellent presentation of the degree applicant and his work at your department. So, dear colleagues, is anybody else willing to speak? Council members or other attendees? Thus, discussion, I declare the discussion over, And before we summarize and vote, let me ask the council members and the degree applicant if council members and the degree applicant have any remarks or questions regarding the procedure of the session, including remote access mode. Please answer. No, all is well. No, we don't have any questions. Then let us proceed to the next point, which is voting. And before we vote, we have the opportunity to take a break to discuss the results of the broadcast shall be switched off. What do you think? Do we need such a break to discuss the results, or shall we just continue our session and proceed to voting? I would like each council member to give his opinion on this issue. Let's continue. I suggest, yes, let's continue. So we all want to continue. Now is 12:30 Moscow time. Dear colleagues, let us continue our session, and the most important part of our session has come. Please make sure we can all see and hear each other. Yes, we can. I put the question of awarding Drozdov Aleksandr the degree of candidate of medical sciences in scientific specialty 3125 diagnostic radiology to open roll call voting. Let me emphasize that voting for each council member agrees that Article 11 of the order has not been violated. Let me quote this article. In the thesis, the applicant shall be obliged to refer to the author and/or the source of borrowed materials or individual results when using in the thesis the results of scientific works performed by the applicant personally and/or in co-authorship. The applicant is obliged to indicate this circumstance in his thesis. Let me remind you that a decision of the Dissertation Council on awarding the degree shall be considered positive if at least a half, but not less than 3 persons of the Council vote for it, according to Article 23 of the Order. Sebilev Konstantin Ivanovich, what is your opinion? I am for awarding. Please turn the microphone on. I am for awarding the degree to the applicant. Thank you very much. Svetlana Vladimirovna, I am for awarding to the applicant the degree of candidate of medical sciences. Vladimir Alexandrovich, I am for. Andrei Vladimirovich, I am for awarding the degree. Gennady Evgenievich, I am for. Pavel Dmitrievich, I am for awarding the degree. And I am also for awarding the degree to Aleksandr Andreevich, the degree of candidate of medical sciences. Thus, dear colleagues and guests, let me inform you that out of 7 council members present at the session, 7 voted for, no one voted against, and no one abstained. The decision to award Drozdov Aleksandr Andreevich the degree of candidate of medical sciences, scientific specialty 3125, diagnostic radiology, has been made. Closing remarks of the applicant. thinking of my closing remarks and remembering all the colleagues who directly or indirectly influenced this work, I thought that it's unfair that only 2 names appear on the front page of the author of the thesis and thesis supervisor, because it would be the work would be different or would not be possible without so many people. First of all, I'd like to thank my thesis supervisor Vladimir Maximovich and informal thesis Irina Grigorievna Kamyshanskaya. I feel in debt to my teachers. Under their guidance, I not only wrote my thesis, my candidate's thesis, it's only the top of an iceberg, but their role in my life is much greater. When I was a student, inspired by their knowledge and by their personalities, their attitude to work, I chose my specialty. Later, in radiology department of Mariinsky Hospital with Irina Grigorievna and Vladimir Maximovich, I met outstanding people who became my teachers and later my colleagues. I would like to thank Ludmila Ilyinichna Sigitova, Yulia Sergeyevna Natalia Igorevna Mutovkina, Pavel Igorovich Semyshenko, Aleksandra Sergeyevna Kudashkina, Victoria Vladimirovna Pritz, Anna Valerina Zakharova, Vsevolod Vyacheslavovich Danilov. Special thanks I'd like to give to Bodkin Hospital staff who patiently shared their knowledge and experience in treatment and diagnostics of AIDS-associated diseases. Dr. Yakovlev, Vladimir Ivan Pavlovich, Oksana Ivanna Fedunyak, Olga Valerina Vitenko, Maria Nikolaevna Artemyeva, Mikhail Andreevich Savchenko. I am very grateful to the council members for their valuable time which they spent on analysis of my thesis and on taking part in this in the council session. I knew that I had many competitors, but you agreed to participate, and I thank you for your interest and for your professional curiosity. I'd like to thank my family that gave me support over 7 years. Thank the Dissertation Council Activity Support Officers of St. Petersburg University for their professionalism and very reasonable approach to thesis presentation and defense. And in conclusion, I'd like to say that I believe in the oncology and radiology diagnostics at St. Petersburg University. I had the best doctoral course that a passionate student can hope for, and I'm so glad I could suggest my ideas, and my teachers helped me to choose the best ideas on which my today's work is based. Thank you very much. Aleksandr Andreevich, we'd like to thank you also. We all congratulate you, and I declare our session closed. Please stop the broadcasting. Thank you.